Today's topic is the liver, which is the vital organ which is presented in the abdomen. So in this video we are going to discuss about the liver. So first, in the introductory part, you have to write or we have to speak about the function of the liver. So first, coming to the function of the liver, the glucose is stored as glycogen in the liver, so that the blood sugar glucose level can is get reduced, and the glucose in the blood is collected and stored as a glycogen in the liver. Secondly, it secretes the bile, which involves in the digestion process and makes the digestion easier. And it also synthesizes the albumin, which is a plasma protein, is also synthesized in the liver. So coming to the excretion process, in the liver, the unconjugated bilirubin is converted into the conjugated bilirubin, so that the excretion process becomes easier. So these are the main function of the liver. Coming to the location, we have to speak about the location in the abdominal regions. As we know, there are 9 abdominal regions, whereas the liver occupies the right hypochondrium, left hypochondrium, and epigastric regions. As we know, the liver is the right abdominal organ, so it occupies the right hypochondrium and some extent into the left hypochondrium, and the region between the right and left hypochondrium is the epigastric region. So in these three abdominal regions, the liver is located. Coming to the rib, on the right side, right border of the liver is related to the fifth rib, whereas left it is related to the fifth intercostal space. Coming to the border, upper border of the liver is located at the xiphisternal joint. Okay. Whereas lower border is located at the transpyloric level, that is located in the L1 level. Okay. So these are the location of the liver. So when we are speaking about the location of the liver, first we have to speak about we have to write about the abdominal region's location and whether the organ is related to ribs or vertebra. If it is related to ribs, we have to write the relation in the ribs, and we have to write about the upper border and inferior border where it is located according to the liver. Coming to the shape of the liver, it is wedge shaped and color reddish brown, and normal average weight is 1.2 to 1 kilogram. Okay, so these are all about the liver. So coming to the external features, we have two surface, that is diaphragmatic surface and inferior surface. This diaphragmatic surface again is divided into superior, anterior, posterior, and right lateral. So these are the surfaces in the liver, that is external feature. So coming to the lobes and segment. So segment, actually liver is divided into 8 segments. So this is the first segment, which is inside the liver. This is second, this is third. So this is first, this is second, third segment. So fourth segment, which has 2, but we have considered as a 1 segment, fourth segment whole. Okay. Coming to the fifth segment, sixth segment, seventh segment, eighth segment. Okay. In liver there are 8 segments. So according to the first segment is referred as the quadrate lobe. Whereas fourth is referred as the quadrate lobe. Okay. So these are the main segments of the liver. Coming to the lobe, so we have normally right and left lobe. Okay. So but the right lobe is somewhat bigger than the left lobe, whereas in physiological lobe, the right and left lobe will be presented equally. Okay, which divides the liver into 2 equal halves, that is physiological lobe. Okay. Coming to the relations of the liver, we have peritoneal relation. First we have to speak about the peritoneal relations. So normally the liver is covered by a peritoneum, but some of the areas are devoid of it, such as bar area, groove for IVC, fossa of gallbladder, fissure for ligamentum teres, porta hepatis. So in all these regions, the peritoneum is absent in the liver. Okay. So to know something about the porta hepatis, it consists of bile duct, hepatic artery and portal vein. So all these together known as porta hepatis. Okay. So what are the porta hepatis, which consist of bile duct, portal vein and hepatic artery. Okay. So coming to the visceral relations, as I said, we have inferior surface, diaphragmatic surface, superior surface, anterior surface, posterior surface and right lateral surface. So coming to the superior surface, so this is the superior surface. Okay, superior surface of the liver. So in superior surface, it is related to the diaphragm. So as superior surface is one of the surface of the diaphragmatic surface. So this superior surface, here it is related to the diaphragm. And in diaphragm, in the center, we have a cardiac impression. So that only the ribs or the diaphragm is somewhat like this. So this is known as cardiac notch of the diaphragm. So this liver as superiorly is related to the diaphragm and the cardiac impression. Okay, there is superior relations. Coming to the anterior relation, see, anterior relation, within the liver, the anteriorly located is the anterior abdominal wall. Okay. So posterior and inferior relations we will be seeing as a together, as a posterior inferior relations of the liver. Okay. So this is the posterior inferior surface relations of the liver. So here we can see the IVC. Okay. Here we can see gastric impression, esophageal impression. This is the porta hepatis. What I said, what are the structures? Bile duct, hepatic artery and portal vein. Okay. And quadrate lobe. Here we have caudate lobe, renal impression. Okay. So these are the relations. Okay. So first you have to see from the above surface. That is, first you have the caudate lobe. This is the bare area of the liver. This is the suprarenal gland. This is the renal impression. Okay. This is the quadrate lobe. This is the esophageal impression. This is the gastric impression. So this is the falciform ligament. Okay. Which comes under the false ligament of the liver. Okay. So this falciform ligament, here you can see the left triangular ligament. Okay. So here you can see the fossa of gallbladder. Fossa of the gallbladder, where the gallbladder is located or related to the liver. So this is the posterior inferior surface of the liver. Coming to the right lateral. So in this picture you can see the right lateral of the liver. This is the right lateral. So normally the liver is related to the 9th and 10th ribs on the right lateral side. Normally on the right lateral side, Seventh and eighth ribs consist of both lungs and the pleural cavity of the lung. In the ninth, you can see the pleural cavity of the lung, whereas in the ninth and tenth, you can see is devoid of both pleural cavity and the lung cavity. So, okay, these are the right lateral relations of the liver. So, coming to the blood supply of the liver is somewhat unique than the other organs because vein is involved in the blood supply. 80% of the nutritive blood is supplied to the liver by the portal vein. Remaining 20% is supplied by hepatic artery. So coming to the venous drainage, 3 veins are involved. Right hepatic vein, middle hepatic vein, left hepatic vein. Okay. So coming to the nerve supply of the liver, we have both sympathetic and parasympathetic innervations in the liver. So whereas sympathetic nerve are mainly derived from the celiac plexus, whereas parasympathetic, as we know, it is supplied by the vagus nerve. In vagus nerve, we have two trunk, anterior and posterior. But in the liver, the anterior vagal trunk is involved. That too, hepatic branch of anterior vagal trunk is involved in the supply of the liver, nerve supply of the liver. So coming to the lymphatic drainage of the liver, we have superficial and deep. In superficial, we have anterior aspect and posterior aspect. Anterior aspect is drains into the hepatic nodes, which is presented in the porta hepatis, whereas posterior is drains into posterior mediastinal lymph node. Okay. In deep, we have ascending trunk and descending trunk. Ascending, which ascends up and drains into the IVC lymph node, the lymph node which is presented surrounding the inferior vena cava, and descending trunk to the hepatic node which is presented in the porta hepatis. Okay. So these are the lymphatic drainage. So coming to the applied aspect, we have mainly two, that is liver cirrhosis and the liver biopsy. Biopsy is something the tissue is examined whether it is in a normal condition or it has some defects. So that is known as biopsy, whereas when the liver tissue is taken, that is liver biopsy. Okay. So coming to the liver cirrhosis, so this is the normal liver. Okay. Whereas this normal liver is later appears as like this with the cirrhosis. Cirrhosis is nothing but when the liver tissue becomes fibrous and it loses all its function. The function of the liver will not be taking place. Okay, so which is referred as liver cirrhosis. So coming to the biopsy, as we saw the right lateral relations of the liver. So to take the liver tissue, biopsy, as I said, it is the examining of the tissue. So we have to take the liver tissue. So we should not inject into the lung pleural cavity, or we should not. So the needle in the liver biopsy is inserted between the 9th and 10th rib, so that we can take the liver tissue and we can examine and we can able to conclude whether the liver is in good condition. So that we while injecting needle in the 7th or 8th ribs, between it we can reach the pleural cavity or lungs. So to avoid it, we have to inject the needle at the 9th to 10th rib space. Okay, so these are the main clinical features regarding the liver. So these are about the livers. So okay, thank you.